This explainer is based on a chapter from the book Mazha Madhumeh Maze Niyantran. For more details, visit www.schoolfordiabetes.in.
So what if I told you that the most powerful medicine for a lifelong condition like diabetes isn't a pill, and it's not an injection either? What if it's information? That's the big idea we're going to dig into today, how having the right knowledge can literally become its own cure, putting you firmly back in control of your own health. But before we get to the solution, we've got to get real about the problem. You see, for millions of people living with diabetes right now, the whole healthcare journey is just way more complicated than it should be.
And this number, well, it says it all, doesn't it? A massive 80% of people with diabetes, 80%, don't have their condition under good control. Now, let's be super clear about this. That is not a personal failure. It's not. It points to a much bigger issue in how we've been approaching this whole thing.
You know, for years, the model was simple. You have one doctor, and they guide you. But medicine has become so specialized now. Think about it. It's almost impossible for one person to be an expert on every single part of a complex, lifelong condition. So that specialization, which is supposed to help, can actually create some really big gaps in your care.
And this leads to something that's, actually kind of heartbreaking. It's called the orphan patient. You've got your heart specialist, your kidney specialist, your eye doctor, but who's looking at the whole you? With all that responsibility spread out, it's so easy to feel lost, kind of adrift, like you're all alone with no one really guiding the ship.
And that forces you to ask a pretty tough question, right? Is just following orders from a bunch of different doctors really enough to manage something you live with every hour of every day? All the signs are pointing to a new way forward.
Okay, so let's shift gears. We've talked about the problem. Now let's talk about a truly revolutionary solution. It's called Therapeutic Patient Education. This is where we find out that knowledge isn't just power, it's probably the strongest medicine we have.
And this quote, this is the core of it all. Of course, medicine is essential, but on its own, its effects are limited. Real, life-changing control comes when you understand your condition so well that the scariest complications of diabetes aren't just treated, they can be completely dodged from the start.
And just so you know, this is not some new fad. The idea that patients need real, structured education goes all the way back to 1972. Then, by 1998, formal programs were proving just how well it worked. And today, it's seen as a totally essential part of any effective diabetes plan.
This chart just lays it out so clearly. On one side, you've got the old way, which is all about compliance. Just do what you're told. But when you add structured education, you get self-management. You actually understand why you're doing it. And the results? Just look at that last line, an 80% drop in amputations. That is an absolutely life-changing number, and it's driven entirely by knowledge. So we know that knowledge is everything. But what does this self-management thing really look like day to day? Well, the answer might just change how you think about who's really in charge of your health. Okay, take a look at this. I mean, it might seem a little shocking at first, but it's the honest-to-God truth. That tiny little sliver, that 0.1%, that's the time you're with your doctor. The other 99.9%, every meal you eat, every walk you take, every single choice you make, well, that's you. You're already in the driver's seat. And real control, modern control, is about so much more than just staring at one number on a glucose meter. It's about looking at the whole picture, your entire body as a system. It's about total well-being. And that means you've got to master these 5 pillars. It's about actively managing your weight, your blood pressure, your cholesterol. It means being proactive about taking care of your eyes, your kidneys, and your feet. And, maybe most importantly, it's not just taking your medicine, but knowing exactly why it works. That is what comprehensive self-management is all about. But you know what's really amazing? You don't have to figure all this out on your own. Diabetes is a social thing, right? It's tied to our lifestyles, our communities. Trying to change all that by yourself is, well, it's really, really hard. But when you're in a small group, you share stories, you share the costs, and you build this incredible support system that makes the whole journey not just easier, but way more successful. You are not alone in this.
Okay, so to really grab the steering wheel, you need the right tools. And the most important tool you can have is language. You have to learn to speak the language of your own health.
I mean, think about it. Every professional field has its own jargon, its own vocabulary. To become the #1 expert on you, you've got to learn the language of diabetes, the words for your body parts, your tests, your treatments. This is step 1. It's the absolute foundation of taking back control.
And we're not talking about something vague here. It's a real vocabulary, about 800 words, and you don't learn it by just reading a pamphlet. No way. You learn it by doing, by using the words, tracking your own numbers, and making it a real part of your life until it just becomes second nature.
And this learning process isn't just random. A good patient education program is like any school. It has a structured curriculum. It'll cover everything from how your body works and the science of nutrition, all the way to how to read your own lab results. It's a full education all about you.
So, after all this, what's the ultimate reward? What's the big prize at the end of this journey? Well, it's way bigger than just better numbers on a chart. It's about completely changing your relationship with your own life.
And this might be the most important idea of all. When you finish this education, you're not just walking away with information, you're walking away with fundamental rights, rights that you absolutely deserve as the person in charge of your body.
And these are those rights. The right to feel true self-confidence, knowing that you can handle this. The right to have self-esteem, feeling proud of how you manage your health. The right to own your story by creating your own health records. And maybe the most important one of all, the right to learn, the right to make a mistake, figure it out and get back on track, all without judgment.
And that really brings us to the final thought here. Look, managing diabetes is a long road trip, not a sprint. It's a lifelong journey. So the only question left to ask is a simple one. When it comes to your health, who do you want behind the wheel?